Thanks, Kaarin. So, as I spoke about earlier today, the work at Melbourne has crossed across research projects around population ageing, but also around individual ageing. And we've developed two online resources that have been quite widely used. First one is the data archive. And as I mentioned before, up until CEPAR 2, there'd been very little research building a set of coherent population projections that were looked at subgroups of the population. So one way in which we attempted to provide this work to users is through the data archive. Currently, we've got all of these following projections are available in the archive: the Aboriginal population, states and territories, birthplace, LGBTQ populations, SA3, which is small area level geography, oldest old populations, where we've got new estimates of the populations aged 90 and over, up to 110 years, projections of dementia and COVID-19 and population ageing. It's pretty simple to download the data from the archive. You simply click into your item of interest. There you can access the open access journal article. You're then sent to a form to fill out, and then you're emailed a link to download the CSV or Excel file for any of the projections that you're interested in. So the archive is around population ageing. The metadata database is to assist researchers interested in individual ageing. We sought to develop a database of metadata. So what's metadata? Metadata is data about data. And essentially what we've done is stripped a series of sample surveys of all of their data codebooks. So we have a database measuring all the different types of variables, how they're measured, how they're categorized, and access to the data custodian and how you go about getting access to that data. Creating the database is one thing, but we also wanted to provide a tool to enable researchers to analyze that metadata. And we've developed an introductory guide there that's available in Australian population studies. So the steps in the process was firstly to the identification of relevant data sources. We included only sample survey data in unit record file from 2010 through to 2018 is the current metadata database. And it had to have data relating to participants aged 45 and over. We excluded, for the purposes of this project, all administrative, qualitative or mixed methods data, or for sample survey data where the data custodian information wasn't available. The next step was to index the available surveys with fields like file creation date, sample design, survey type, unit of analysis, the sampling frame, details of the fieldwork, geographic sampling frame, and other survey description items. Then we had to scrape all of the metadata from surveys. Where the data dictionaries existed, this was a relatively straightforward task, but where a lot of the data dictionaries existed in paper forms, that was messy. Then we appended all of the metadata into a unique database and developed a website so users can view the data. So in total, we brought together about 85 surveys over that period, a mix of census, cross-sectional, longitudinal, repeated cross-section data. And the database has over 110,000 variables in the database. And this is what the database looks like. So the database loads up with all of the components, which you can either include or exclude using the selection panel on the right there. And the user can then search within the database. So the top end, I've just given an example of a user who's doing a global search across the full database for disability. And because of my eyesight disability, I can't read the number, but it yields thousands of hits of disability. However, we may want to narrow our search down to whether it's a label or a category or some other measure in the database, depending upon what the user needs are. And both the metadata database and the data archive are available through the CEPAR resources website. And as I mentioned earlier, the data archive, we have a number of new products that will be rolled out over time, and to watch this space. Thank you.
Thanks, Jeremy. Our next speaker is Saman Khalatbari-Soltani from the School of Public Health at Sydney University, and she'll be talking on worldwide data availabilities and gaps in studying healthy ageing.
Thank you so much, Kaarin. Yes, so I'm going to talk about the worldwide data availability and gaps in studying healthy aging and the healthy aging toolkit that we created from this project. So we know that population aging is worldwide, and we also know that while some people age very well and with like fantastic cognitive and physical functioning, some others face like rapid decline in their physical and cognitive functioning and in need of support. However, these differences in how people age is not at all random, and then they are like quite a lot of variable factors such as social, environmental, political factors that shape how people age. And as Sir Michael Marmot put it very nicely, he said that the experience of healthy aging is by no means uniform nor random, and health inequities persist into older age. And the definition of healthy aging proposed by WHO in 2015 tried to incorporate these factors in how they define healthy aging. So I'm going to very briefly explain how they define healthy aging. So they focus on the process of developing and maintaining the functional ability that enables well-being in older age. And functional ability refers to capabilities that enable all people to do and to be what they have reason to value. And then further, they explain that functional ability comprises of intrinsic capacity, which relates to all of these capabilities like physical functioning, sensory functioning, cognitive functioning, and so forth, as well as the environmental factors and the interaction between the two. But just looking at this slide, we will immediately think that to measure healthy aging, we probably need to have quite a lot of various measurements. So that's why, as Kaarin mentioned this morning, highlights the importance of cohort studies in studying healthy aging, its trajectory, and also the role of social and environmental factors, because cohort studies follows a group of people over a time, so and with various measurements, repeated measurements that enables us to study healthy aging. So then, in response to the UN Decade of Healthy Aging calls for guidance on data collection, we aim to identify and systematize aging cohorts across the globe and to provide a summary of characteristics and measurements that are relevant to healthy aging. And from this, we created a web-based inventory, which we called it the Healthy Aging Toolkit. So a brief overview of what we found. So in this slide, you can see the geographical distribution of cohort studies across the globe. So as you can see, North America, Europe, and Asia, as well as Oceania, has quite a lot of good numbers of cohort studies that could be used for study aging or healthy aging. However, South America, Africa, and Middle East, there is a need for improvement. And if we look into a little bit more details to see from which countries in these geographical regions actually these cohorts are coming from, you can see that there are, like even in Europe, North America, Asia, there are still improvement, and some of the countries don't have any cohorts to be used to study healthy aging. And we also looked at some measures. So, for example, regarding demographic, socioeconomic, social, and environmental factors, if you look at the Oceanian cohort studies, you can see that while we have good data on ethnicity, birthplace, education, occupation, but there is like still room for improvement to collection of some other data, for example, housing, neighborhood condition, wealth as one of the most important socioeconomic indicators at all the ages. And similar issues with healthy aging domains. So while we have like at least one measure related to each domain, there is still room for improvement, especially regarding objective measurements. So from these two slides, you can see that there is currently wealth of data that we can use to provide evidence-based information to promote healthy aging and reduce its inequities. However, we also managed to highlight the limited data availability in some regions. And this paper is just recently published in Aging Research Reviews if you are interested to have a look at it. And then from the result of this project, with support from CEPAR, we created the Healthy Aging Toolkit, which is freely available on CEPAR webpage, as Jeromey showed on the resources section of the CEPAR webpage. And for there is a map under the toolkit section of this Healthy Aging Toolkit. For example, if you are interested to answer a question in Australia, you click on Australia and then you can select some variables that you need to answer your question and click apply, and then you can see a list of cohort studies that have the measurements to help you to respond to your questions. And this is a zoom out version of the previous slide for you to see. But from here, it's up to the researchers to go and contact the chief investigators and request for access to the data. This is just to save time for researchers to find which cohort studies have their measurements of interest. And in the About section of this toolkit, we explain the rationale and how to use and cite the toolkit. And there is also a section for contacting us in case that we miss the cohort studies or some information, so we can update the data that we collected. So the whole point of the Healthy Aging Toolkit was to help researchers find relevant cohort studies to conduct a study into aging trajectories and inequities in health of older adults, and also to provide guidance on data collection gaps that need to be addressed, hopefully further support to global, regional, and national monitoring of action programs and policies. So since the October 2023, which we launched the toolkit is the second most reviewed webpage on CEPAR with more than 2,000 views from over 1,000 different users. And we already used Healthy Aging Toolkit to have some policy impact. For example, from the data from Oceania, we further search to see whether we have enough data on housing condition, and we made a submission to Treasury on measuring what matters, and then they considered on their first Australian wellbeing framework on measuring what matters. And the toolkit is now showcased in the UN Decade of Healthy Aging Progress Report as a case study. And I was contacted by the WHO, and I'm hoping that they will consider this on the aging data platform that they have. Yeah, and finally, I have 1 minute to make my acknowledgement properly. So I wanted to mention the support from Professor Fiona Blythe as a senior advisor of this 3 years endeavor, as well as my research assistant, Yafei, and 2 students that were funded through CEPAR, and also Silky Ways, who helped me to have the toolkit ready, and also my sister, who did the graphical design of the toolkit. And I wanted to say thank you to CEPAR for providing funding to make this project happen. Thank you.
Thank you, Saman. Our next speaker is Yvonne Leung, who's going to be telling us about the PATH study and policy reports.
Hi. Hi everyone, I'm Yvonne. I'm a CEPAR postdoc fellow working with Kaarin, and today I'm going to highlight our PATH study, but also some of the policy reports that were generated using the data from the PATH study. So PATH was a study that was led by Kaarin since 2006, and it is a large ongoing population-based longitudinal cohort study. If you scan this QR code, it will bring you to the website of the PATH study if you want to know more about it. So the overarching aim of the study is to track and define the lifespan course of depression, anxiety, substance use, and cognitive ability. Try to identify environmental risk and protective factors within these domains, but also examine the relationships between depression, anxiety, and substance use with cognitive ability and dementia. So participants from PATH were randomly sampled from the electoral roll of ACT and the nearby city in 1999 and 2000, and they were followed up approximately every 4 years. At baseline, we have recruited more than 7,000 adults in 3 age cohorts of 20 to 24, or we call it the 20th cohort, 40 to 44 years old, and 60 to 64 years old. And we have a range of measurements, including demographics, their mental health, their occupation, social support, but also activities they were engaged in, leisure activities, volunteering, caring, but also their early and recent life events, physical health, physical activity, diet, other lifestyle factors. We also had a very comprehensive neuropsychological assessments on their cognition, their cognitive engagement. We also had diagnosis of mild cognitive impairment and dementia. We also have collected blood samples to look at genetic markers, personality, but also their health service use. At the moment, we have 6 waves of data collection, and along the way, we also have sub-studies. We also have sub-studies, including the MRI study and also the health and memory study. And just want to highlight that approximately there were 78% of the 40s and 80% of the active 60s cohort resided in the ACT at the last follow-up. There have been data linkages with PATH, so currently we have linkage to the National Deaths Index, Medicare Benefit Scheme, Pharmaceutical Benefit Scheme, and also the HIWH dementia dataset. And previously we have linkages to the ACT Emergency Department Information System, ACT Admitted Patient Care Data, PEP Test Register, Breast Screen Register, but also the Cancer Registry. Over 300 research articles have been published based on data from the PATH study. If you want to check out the list, again, you can scan this QR code. It will bring you to the publication list on the PATH study website. So today I'm going to highlight 3 of the policy reports that were generated based on data from PATH. These are published in 2023, prepared for ACT Health. So the first one is about the impact of the 2019-2020 bushfire on older adults. The second is to look at early impact of COVID-19 and lockdowns on health outcomes. And the last one, which included data from all three age cohorts, looking at physical health, mental health, and well-being and independence-related factors of healthy aging. So this QR code will bring you to the full online report of this policy report. So in this particular report, we look at the impact of the 2019 bushfire on people that at the time aged 59 to 65 years old from our 40s cohort. Because we have data collection before the bushfire, that's why we were able to have an additional ad hoc questionnaire after the bushfire to capture the experiences with the incident. And what we found is that direct exposure to bushfires led to a significantly worse outcomes on mental health, specifically on anxiety, depression, but also general physical health and psychological trauma measures. So on this graph here, we have measures of anxiety and then two different measures on depression. And the lightest blue shows before the bushfire, and the ocean blue shows during the bushfire, and the darkest blue shows the level of anxiety after the bushfire. We also found that women experience more negative effects on mental health than men as a result of direct fire exposure. However, feeling better prepared for bushfires was associated with more positive scores on measures associated with anxiety, depression, suicidality, psychological trauma, and sleep quality. Again, this is a QR code that will bring you to the second policy report that I'm going to highlight, which is looking at the early impact of COVID-19 and lockdowns on health outcomes. So in this particular report, we found that higher scores on the COVID-19 questionnaire, in other words, looking at the impact of COVID-19, were correlated with poorer general mental health and sleep quality. So this is a list of outcome variables that we had looked at. So mental health, including, again, measurements of anxiety, depression, overall mental health, but also other variables as well. We do find little difference in mental and physical health outcomes before and after the pandemic. And because data collection about the bushfire experience was happened before the data collection on the COVID-19 experience, we were able to look at whether the exposure to bushfires has an impact on how well people cope during the lockdown period. And we do find that direct exposure to the bushfire was associated with poorer coping during the lockdown periods of the pandemic. And lastly, the third policy report is about whether there are cohort differences, so the 20s, 40s, and 60s cohorts, whether there are differences in their healthy aging trajectories. So if you scan this QR code, it will bring you to the full report again. So when we look at healthy aging trajectory, we're looking at the physical health and chronic diseases. We look at mental health and well-being, but also functional independence. So in this particular report, we found that physical health declined with age, while mental health improved over the years. So the blue line shows the trajectories of the youngest cohort, the green line shows the middle cohort, and the purple one shows the oldest cohort. And the one on the left is the mean physical component score, and the one on the right is the one for the mental health. So you can see that it go kind of opposite directions. We also observed sex differences in the trajectories, so prevalence and risk. So prevalence of diabetes and hypertension and those taking cholesterol-lowering medications was higher in men than in women. But prevalence of obesity, arthritis, thyroid disorders, cataracts, or depressive anxiety disorders was higher among women than men. We also found that the youngest cohort recorded poorer outcomes in anxiety, depression, and obesity than the middle cohort at the same age. So the part study was jointly hosted by UNSW and ANU, and CEPAR has funded the Wave 5 follow-up and for the 40s cohort and Wave 6 follow-up for the 60s cohort. Thank you.
Thanks, Yvonne. Our next speaker is Daniela Andrei, who's talking about leading an age-diverse workforce in the Ascent Leadership Development Program.
Thank you, and hello everyone from another WAPI person. Happy to come to UNSW, and as you might or notice already, is not my name on the presentation, is my colleague Leah, who was supposed to be here and present this work to you. Unfortunately, she couldn't come for health reasons. CEPAR was so flexible and immediately officially replaced her with my name, but I just want to acknowledge that this is very much Leah Zozak and Eva Zellman's baby in terms of a project for which Sharon and I and our larger team provided a lot of support and contribution, but they've delivered it. So I'm very excited to be able to present it to you today, and hopefully I do it justice. As Sharon mentioned a little bit earlier, we had a few different large, big, scary research questions in stream 3, and we answered them in very different ways, but one in which I want to focus more today was the intervention side of the things. So Sharon presented more around the research side of things, but as Marianne also mentioned a little bit earlier, in parallel with that, we actually had quite an involved and sustained interaction with organization, trying to actually push them to implement interventions. And it was a quite consuming process because we were aiming to get organizations on this journey with us, going from detailed policy reviews to employee input through interviews and surveys, and analyzing feedback and giving it back to the organization, use it as an opportunity for us to co-design together interventions so that they are tailored and they respond actual needs, and then implement solutions. And we've attended this with about 11 organizations in WA. Not all of them went till the end. We lost about half of them along the road there for different reasons, COVID also being included, but today I'm gonna present one that went up till the end, and we managed to implement the leadership development program. Of course, that this development program was had its roots and was guided by the framework that Sharon presented a little bit earlier. I'm not going to present it again, but just highlighting that for the purpose of this leadership development program, we've tailored a little bit and translated the meta strategies to bundles of strategies and behaviors that leaders themselves can take to create more age-inclusive work teams and environments. And the way it got translated in the end in the projects looks something like this. So we had a structure of several sessions that were delivered to leaders on a time span of about 3 months. Of course, we are researchers, so we started everything with pre-training measures. Then we took them through extended workshops on include strategies, on individualized strategies, on integrate strategies, on skills for impact, because actually what we're finding in our work with actual organizations, beyond learning age-specific strategies, leaders also need just good generic leadership strategies and behaviors. And of course, because we're researchers, we know that actually the hardest thing is to ensure that leaders can take what they learn from us and actually apply it in practice and keep it active and fresh in their minds. So for that reason, we built the booster section, which happened relatively 3 months after the four sessions, and also individual coaching sessions at the end of the program, where we could discuss in more details and personalized ways to ensure that the leaders who participated in the program could take the learnings and apply them in their work context. So we've implemented this program in a local government organization in WA. We had 35 leaders in our training group. We had 19 leaders in our control group, and we also tried to look at what are the impacts of this training on not just the leaders themselves, but also the ones who they provide leadership to. So we also surveyed a group of subordinates. And I'll just provide you a few insights from the data analysis that we have done to look at how successful we are in developing leadership capabilities and strategies to effectively manage age-diverse workforce. We do that not just because we're researchers and we want to be able to have a paper at the end of it, but we also know how important it is when we go and actually advocate for this kind of interventions in organizations to be able to demonstrate that the learnings and the benefit that we are producing is tangible, and there is an opportunity for return on investment there. So the first insight that we take, actually by looking at these graphs in overall, I would say the first insight for me there is that technically we are preaching to the choir. So if you look there, both our pre-training, both our training and control group were quite high on strategies to start with, especially include strategies, but also individualize and integrate. And that's also a result of the fact that they could self-select and volunteer to participate in this training. So the people who actually are doing things quite well are the ones who have this issue on top of mind, and they actually want to know more. And probably a takeaway from this is more around how can we reach the people who actually need this training more, but that's just a thought. In terms of include, we didn't see an effect there, probably also because of that ceiling effect. But what's encouraging was to see that we did generate increases in individualized types of behaviors and strategies and integrate type of strategies, where we could see improvements for the intervention group in between pre and post training. We also wanted to check whether we've managed through the training to, in a way, disprove some of those stereotypes and knowledge that people think they have about aging, and to see if we've improved people's attitudes towards aging workers. And for that scope, we created a knowledge test, which again, we could see that pre and post training, there are effects in terms of better knowledge about aging in our participants. In terms of stereotypes, not much movement there, but what is encouraging is to see a little bit of a drop in negative stereotypes in the control group. Positive stereotypes about aging remained not changed. Beyond just the effects on those behaviors, what was also really important for us was the fact that our leaders who took their time out of their busy schedule to participate had very good perceptions about the workshop. They perceived it as really engaging. They loved their time there. They loved Leah and Eva who delivered the workshop. And you can see some of our participants there in the photos. What's also important to notice is the fact that things have not ended with just the program. We are actually taking it further. This year, we developed a two-day masterclass, which I, together with Eva, delivered as part of the Curtin Executive Education Program. It was developed a little bit late, so we had only 12 participants, but the type of feedback that we had was extremely positive. It's been already commissioned for the next year. I've also been just asked to develop another one-day version of the program as part of a large-scale program that we are delivering for Rio Tinto as part of their leadership capability academy, and it will be delivered to up to 500 superintendents with the first 7 cohorts scheduled for next year. Our funding through CEPAR has enabled us to collaborate with people from Europe. So you can see there that our collaborator, Dr. Franziska Jungmann, has delivered the program also in Germany and Australia and Austria. And last but not least, we have a toolbox of resources, and we are developing actively a MOOC. So the baby has been successfully delivered, but more than that, I think we are taking care of it and making sure that it's slowly gonna be able to independently walk by itself. Thank you.
Thank you, Daniela. Next, we have Alison Williams from the University of Sydney Business School talking to us about positive lessons from researching older workers in organisations, from policy review to intervention.
Make sure I'm going in the right direction with this thing. Hello. So first of all, I would just like to acknowledge the traditional owners of the lands on which we're meeting today and pay my respects to their elders past, present and future. I'm going to be running you through a few aspects of our project that we conducted in Stream 3 of CEPAR. Daniela's actually just gone over a little bit of the design, which I'll also be going into, but focusing on policies and interventions. There we go. So lost the same slide, Marion. How funny. Okay, I was going to try and locate where we were within our stream. So we're 3.4, which is to looking at where policies and that promote effective care outside of work. So just to sort of locate us. All right, so within that program, we, like the Curtin team, we conducted a multi-stage process of research whereby we looked at we contracted with a number of organisations, and we took them through this research process, starting with looking at the sort of their organisational data. We then reviewed their policies, which I'm going to look at a little bit specifically today. We interviewed older workers, we interviewed key informants, we conducted a survey with them, and gave them very extensive feedback through all the stages of the program. And again, trying to push them to implement an intervention in their organisations that's going to assist their older workers and hopefully will assist them to balance their work with their caring responsibilities. There are certain aspects which can help that, particularly around their flexible working practices. So our Sydney University team, we engaged with 5 organisations. We had 4 public sector and 1 private sector. From the policy review aspect, I reviewed on average about 44 documents per organisation. It was quite an extensive period trying to get all their documents together and actually look at what were they actually doing, were they even thinking about older workers in their HR policies and industrial relations policies. Were they just using existing materials, or were they forward thinking? And then I gave a very extensive report back to those organisations, and I gave them recommendations based on what I could see in their policies, and also gave them commendations because some of them were doing a really good job. Probably more were doing not so good job, but some were doing okay. So in the process of examining their policies, we used a policy ladder. That was because we were very interested in looking at how policies interact with each other, because most policy work on older workers concentrates on the public policies or the organisational policies. It doesn't look at how the interactions between them. And so that was the purpose of this model, using these rungs to look at, well, there's the statutory, very enforceable part of policy, and in the Australian context we have enterprise bargaining, we also have industrial awards. They also form part of policy, and then the organisational policies, of which there may be many or there may be few, working up towards discretionary practices at the supervisory level. Now, for each of our organisations, we categorise their policies by policy themes, and this was based on research by Epler-Hattab et al. 2020 model. And the purpose of doing this was to see where how much depth there was to the policy development. For example, you can see in that slide that towards on the right that equality and fairness and health and well-being, flexibility, that's where the heaviest policy development is, but not very much at the job design and redesign level, and not very much really overall in retirement and redeployment, even though retirement is actually an area which most older workers will at some point proceed towards. So it seems that if there's a lot of statutory activity, then this actually promotes the policy engagement at the organisational level. They sort of duplicate each other, and one of our key informants told us that, well, we got this in the enterprise bargain, so now, somebody asked me about it, so now we need a policy. But that's good because it shows that there's actually, they're now having to think about it. So then we looked at, we tried to move our organisations to this intervention stage, and there are difficulties with doing this research because it takes a long time. It's very concentrated sometimes, and then other times it's not so concentrated depending on what the actual organisation's needs are at the time. But with this particular, 2 of our organisations, we were interested to see that we made recommendations to them, as I mentioned earlier, and the sort of intervention they wanted to introduce was this mature worker employee reference group. Now, one was in the private sector, it was a law firm, and the other one was in the public sector, a state government department. And these employee reference groups are official voices to management. They're actually set up by the employer and recognised as such. It's not just an informal grouping of older workers. And the things that they actually wanted to address were in the policy sphere. They wanted to influence their employer in terms of their flexible working arrangements. They wanted more resources for older people, and they wanted to look at their workplace culture and how that addressed their care needs as well. So one of the organisations actually then fed into the information from their staff engagement survey. They then fed that to their employee reference group and deliberately sought their feedback on that. And we found a very interesting development from both of these groups was that they didn't see themselves as a separate group of older workers. They both, in very separate organisations, they both evolved into groups that saw themselves as being also able to assist their younger colleagues, because they were like, they will be us one day, was what one of them said to us. So that's a very interesting development that they're specifically set up to affect for older workers, but they can see that there's lots of synergies between the two groups. Now, for one of our organisations, this was our law firm, they were very interested in the policy review, and in fact they implemented virtually everything that was recommended to them. They reviewed their recruitment, their dispute resolution policies. They brought in a new career progression component to their performance policy, so that mentoring had to be part of performance. They brought in a new diversity and inclusion policy. They actually introduced job sharing so that it was just available to their admin people, but now that they were going to bring that across the board to their legal employees as well. And then they introduced new leaves, particularly aimed at helping people with their care needs. Grandparent leave. This is a policy that there's a bit more interest now in the Australian environment, and where grandparents can use their leave to look after their grandchildren. And then they too became very interested in transition to retirement, because they had problems with particularly their older lawyers who were when they retired, they just left the firm and they took so much of their knowledge and their client contacts with them. So they introduced a transition to retirement scheme. Almost done, are we? Yeah, okay. And with flexible working, mentoring and coaching. So in summary, the policy ladder shows that organisational policy is the sweet spot. That's where organisations can really start to build on what's already there at a statutory level. There was, in fact, a dominance of these policies of health and wellbeing and flexibility, so they all help older workers who are carers. And from a research point of view, very difficult to get to the intervention stage. And just one more thing, I'll just give our book another plug. Thanks very much.
Thank you, Alison. Our next speaker is Michelle Vujagina. She'll be talking about modelling retirement income risks and solutions, a retirement income toolkit in R.
Thank you. Good afternoon, everyone. So I'm a senior research associate at CEPAR at UNSW, and I'll be presenting on the retirement income toolkit in R that we're using to model retirement income risks and solutions. So this is work that was initiated by Professors Michael Sherris, Professor Yang Shin, and Professor Villegas, and also Professor Jonathan Zive. So in terms of motivations, we're in stream 4, sustainable well-being in later life, and we focus on 4.1, which is measuring mortality and morbidity risks, and using the insights from assessing these risks to inform and guide financial and insurance product design. So our motivations was we've developed a lot of research outputs that were summarized by Professor Michael Sherris in an earlier session, and we wanted to provide the code for these research projects, and in essence we want to extend and develop our code for research applications, both for current research students and other researchers in industry who are interested in the work that we do. So this code would allow us to, would provide a platform for developing our packages and also providing our code-based applications, our code-based application papers. And currently it's in user testing, but there are current versions that are publicly accessible as R modules. And our hope is to develop an R package and code extensions, and also provide an actuarial statistical software paper. There is other code already available. An example is by Mingyi Chu, who was a postdoc at CEPAR, and she developed functional disability models in MATLAB. We also have some code from Francesco Ungalo, and this code estimates and projects affine mortality models in R. So currently the modules are available as a repository, and the documentation is also available on GitHub. And the 4 modules that are available are aggregate mortality simulation, health state modeling, an economic scenario generator, and a module on cash flow simulation and pricing. So in terms of structure, the first module, the aggregate mortality module, it uses outputs from STMOMO, which is a stochastic mortality modeling software in R, and we can also put individual characteristics and rate completion models. And what we get are survival probabilities and simulation plots. In the health state module, we have parameters from functional disability models, static trend and frailty models, and we can also input individual characteristics. And we're able to determine survival, disability and sickness probabilities. And we can also derive simulation plots. In the economic scenario generator module, we have a simulation time frame, and we're able to provide 11 forecasted economic variables and distribution plots. We then combine the outputs from these 3 modules, the aggregation mortality module, the health state module, and the economic scenario generator into the policy evaluation module, where we're able to value different retirement income products, which I'll discuss later on. So as an overview for the aggregate mortality module, we can derive simulating life paths and summary statistics, and we're able to get the period and cohort rates. And for the health state module, we have two models, a 3-state model that has a healthy state, a functional disability state, and an absorbing state, the dead state. And we also have the 5-state model. It's similar to the 3-state one, but it has a chronic health state and another state which combines illness and disability. And from these two health states, Cox hazard models, we're able to derive life table generations and some statistics. And from the economic scenario generators, some of the economic factors that we'll be looking at are the 3-month zero coupon yield, the 10-year coupon, zero coupon spread, the Australian GDP and Australian CPI, and the New South Wales unemployment rate, just to mention a few. And in terms of the final module, which is the policy evaluation module, we're able to price a couple of retirement income products, and these include account-based pensions, life annuities, deferred life annuities, pooled annuities, long-term care insurance, care annuities, variable annuities, and even reverse mortgages. So if you're interested in some of our work, you can contact me, and the details are provided on the screen. And we also have the website details for the repository and documentation. Thank you.
Well, it was fantastic. It was great to see all our speakers stick to time, so we've actually made it for a full afternoon tea. So I'd just like you to join with me in thanking all of the speakers again. And we'll see everyone back in half an hour for our next session.